Welcome to nu210. My name is Don Hubbard. I'm an assistant professor in the nursing program here at Louisiana College. First, I'd like to ask that you make sure and read your syllabus in its entirety. It's available on the portal at Louisiana College. It is very important that you maintain all of your logins and passwords and keep them in a safe place, as that you are responsible to use these and to keep track of them throughout the nursing program. You will need to write them down or store them in a safe place, such as on a flash drive or in a safe in your home, because we want you to be able to access any of the online tools at any time. The instructors will not be responsible for you logging in onto the online sites. For Louisiana College, you are responsible to keep track of your logins and passwords. Please make sure you read the syllabus for this course in its entirety, and please be sure to read the reading assignments and the Catalano text, as they will be very important in you succeeding in this course. The thing about taking an online course is that you are responsible for your success. When you succeed, you will be the one that reaps the rewards of your success. If you fail to follow the guidelines in your syllabus or meet the criteria, then it is your responsibility, and it's only upon you. We ask that you take responsibility for all of your work, for your success and your deficits. And let's be careful not to blame anyone else any time that we fall short, but accept constructive criticism, make adjustments in our behavior, in our study habits, and then give it another try. Let's go ahead and proceed with lecture number 1. Dr. David Sharp is to receive credit for putting these lectures together. He composed them last year, and we continue to use them to provide consistency from semester to semester. This week's lecture addresses the question of what is a nurse. Please follow along in your PowerPoint slides that are provided for you as handouts in the LC portal. So first of all, take a look at this question and consider it. What exactly does a nurse do? What do you think a nurse should do? What have you seen nurses do in your experience in the healthcare system here in the United States? Pause the vocal recording for just a few minutes and consider that question. What does a nurse do? When you're ready, push play again. Now we're going to ask you to take a piece of paper and a pencil or pen and just draw a picture of a nurse. This doesn't have to be something that is full of detail or very artistic. Just in your mind, pull up a picture of what you think a nurse looks like and then put it down on your paper. Go ahead and pause the recording and take a few minutes to do that, and then press play again. Now, how did you draw your nurse? Some people, it may be only a stick man. Some people can draw very detailed, elaborate portraits of a nurse. Does your nurse have a cap? Was your nurse a male or a female? Did your nurse have a needle or a stethoscope or some type of equipment? And then, as we pose the first question, what does a nurse do? In your mind, what does that nurse accomplish? Do you think of nursing as a job, an occupation? Or have you gone as far as to say that nursing is a profession? And what is the oldest profession that you can think of? Now take a piece of paper and make a list of some of the professions that you all can think of, that you recognize. such as physicians, attorneys, politicians. Do you include nursing in that automatically? Or have you ever thought of it as a profession? What is it that defines a profession? Well, when defining a profession, our Catalano textbook delineates three approaches to defining a profession. The first is the process approach. The second is the power approach. The third is the trait approach. And in looking at the process approach, we see that there is a process of moving from just completing tasks to meeting professional criteria along a continuum. This means that it is dynamic, and it may not have a clear definition of a profession. So that profession can be defined along that continuum, and that definition can be revised, it can be advanced, it can be added to. And many times, the definition of that profession depends on the public's perception. A lot of times, nursing is not usually viewed as a profession in most societies. Second, let's look at the power approach. The power approach is defined by two criteria. How much independence is there in that practice? And how much power does that occupation or profession control? Power is political power and the amount of money the person earns. For instance, in medicine, law, and politics, which are professions, there's a lot of political power, a lot of lobbying, and there's very, very high, vast amounts of money that are involved in these professions. But is this really what being a profession is all about? Is this how you would define a profession? Is by politics and power? That's the power approach. Third, we look at the trait approach. This was developed by social scientists. Sociology, of course, is something that you studied, maybe an introductory course, so you're familiar with what social scientists do. Some of the common characteristics of a profession that they found were that there was intellectual knowledge involved, there was accountability, there was a specialized body of knowledge, and it required higher education. They did a public service. They were altruistic. Altruism was valued over financial gain. Autonomy and independence of practice. They possess strong professional organizations. Professions have codes of ethics. And they have a strong professional identity, a commitment to development of the profession. They demonstrate professional competency and legally recognized licensure. All of these things are present in the nursing profession. Take just a few minutes and review the material in Catalano that is related to this trait approach. Now, does nursing meet all of these criteria? Some of them, most of them, but maybe not all of them. We do have intellectual functioning. Most nursing tasks we might consider to be menial, but there is an advanced degree of assessment that is required. And some of these tasks that we perform, they demand a high level of skill. And the individual is held responsible and accountable. We as nurses, as professional nurses, are accountable for our practice. We are individually accountable as well as our institutions are accountable for our practice. We do have a body of knowledge that's special to us. We call it nursing science. We use evidence-based practice. And we also set our qualifications in varying degrees and levels, such as associate degree, bachelor's degree, master's degree. The evidence-based practice is something that we've adopted that we think is very important. How do other professions use evidence-based practice? How about the topic of public service or altruism? We in nursing, we believe this is very, very important. And you won't find a lot of rich and famous nurses, but you will find a lot of nurses that care and are compassionate and always, always seek to do the best for our clients. That's very altruistic. We volunteer a lot for the public service, not getting paid, such as Red Cross nurses. We are very well organized. We do have a strong representation. We have organizations that exist, but they're not very powerful. And the membership fees are quite low, ranging anywhere from $200 to $300 or $400 per year to belong to those organizations. And they do participate in political events. We do have codes of ethics. Not just one, but several exist. Sometimes codes of ethics are defined by the institutions that nurses work for. Sometimes they're defined by the state boards or the nurses associations themselves. We do have to obtain professional licensure through our individual states, and we have laws and regulations that govern that licensure. Now, where as a profession do we fall short in nursing? First of all, education. We do not have to have a BSN degree or a baccalaureate degree to be a professional nurse. Many nurses obtained diploma program certification or associate degrees in nursing in two-year colleges or community colleges. This trend has been developing over the past decade and continues to be an issue in our profession. And of course, we believe that there is some degree of autonomy or independence of practice. But we are, in many cases, still viewed as being subservient to physicians. But we are an independent and interdependent discipline. Professional identity and development. What do you think? Is it a job or a career? Is it a profession? Sometimes this is ambiguous. Sometimes we can't really define this. Sometimes it's socially defined or institutionally defined. But as a whole, we see our field of practice as a profession. But it also is our job and it is our career. Now let's look at empowerment. Empowerment is the increased amount of power that an individual group or a group is given or gained. Historically, nurses have not had a lot of power. We're not comfortable seeking power, and others don't want them to have it. Who could you think of that would not want a nurse or the profession of nursing to be powerful? And history has shown that there is a lot of tension, friction, and there have been a few battles over this concept of power in nursing. What is empowerment? Defined by Catalano text, it is the ability or capacity to exert influence over another person or group of persons. But it is a dynamic relationship. It changes. It doesn't remain static. If one person exerts power, the other gives up some power. And this might not just be persons, this may be groups or organizations or other professions. We in nursing deal with many other professions. That's why we call it interdisciplinary practices. People are always in a state of bargaining and changing in relation to power. Now, what are some of the sources of power for nurses? There's referent power. The client can do something that they would rather not do via the therapeutic relationship. In other words, we can change or help change that client's behavior when we enter into this relationship with them. What we're wanting to change is bad behavior, unhealthy behavior, behavior that contributes to their lack of wellness. We want to convince them by presenting evidence to them that they need to change their behavior so that they can be more healthy. Now, the expert power comes from our knowledge, our skills, and those things that we are expert at, it can be used or withheld to influence others. We can derive these things through our education, and it increases as we remain in that position for a longer time. Nurses that have been in institutions and hospitals for several decades, they show a great amount of this expert power because they have honed their skills and refined their assessment skills, their tactile skills, etc. What about the power of rewards? That's the ability to grant rewards to others. And sometimes this can be limited in nursing. That might have to do with the limit in financial assets of institutions. If it's a reward that provides to all the nurses, it can be quite financially taxing upon an institution or hospital. So we don't see this happen a lot. Then there's coercive power. It's the opposite of reward. It's the ability to punish or withhold rewards. This is like negative reinforcement. We shouldn't be using this in nursing profession. Legitimate power, we see nurses that are licensed practitioners that increase in power, and we don't see a lot of real legislative functions. Collective power, it's not well organized, and limited lobbying power in nursing. So we don't see a lot of this in our profession. But how can we increase power in nursing, in our profession? We can do this through professional unity, such as becoming members of professional organizations like the American Nurses Association or the Advanced Practice Nurses Association. We can become politically active, but we usually don't put this on the agenda for our institutions, for our organizations. We don't really encourage it in the workplace to be politically active. Some nurses are more proactive in the political arena than other nurses. How about accountability and professionalism? Does this increase power? Because we do hold ourselves accountable and we do demand that we behave in a professional manner. Networking is a thing of the current technology that we have. Look at the social media and all the conferences that we hold. As you become a nurse and you're established and people get your email address, you will receive many, many invitations to conferences throughout the year. How about the future trends in our nursing profession? Let's take a look at this. Is there going to be a nursing shortage? What has been the history of nursing shortages in the past? It seems that we've had peaks and valleys many times. There is a sustained demand for nurses. As healthcare changes, it's a dynamic process. We find that there is a continuous, consistent demand for nurses. And are we using BSN nurses more now than ever? Or are we moving to using only BSN nurses? Are we phasing out ADN programs, etc.? And nurses are developing as independent practitioners. Nurse practitioners, advanced practice nurses, now work both through collaborative contracts, but this is changing. And the fields in nursing, or the specialties in nursing, they continue to grow and branch out. There is an emphasis on professionalism and professional qualifications in our trending towards the future. We continue to hold ourselves highly accountable for our professionalism and our qualifications. If you succeed in becoming a nurse, then you are the future of our nursing profession.